When we're talking about regenerative and restorative orthopedics versus replacement, the difference is with restorative, we're actually taking cartilage and sometimes bone and restoring a cartilaginous defect where there's a defect in the cartilage of the knee. So we're taking cadaveric tissue and restoring the normal anatomy. With regenerative orthopedics, we're taking either PRP, which is the patient's platelets, or we're taking stem cells and actually injecting them into a joint so that it regenerates cartilage into the knee.
I spend a lot of time on my feet. I'm a teacher and a mom, and whenever I get a chance to myself, I'd like to go for a run. But my knee was really starting to interfere with my life. Sometimes when I would go running, my left knee would really ache, and it would be to the point where I was limping everywhere. When I would teach, I wouldn't be able to walk around my classroom nearly as much as I'd like to. There was one point where I was at a kid's birthday party and I was helping clean up toys, and when I got up, I could not extend my leg. My leg was stuck. I had a cartilage transplant, and 4 months later, I could still teach, I could still run, and I didn't have to put my life on hold. I feel great. I haven't had one of those really excruciating knee pains that I would have prior to the procedure. I feel so great, and I appreciate my body again so much more for what it's able to do, that I find myself running again, I'm exercising again. I'm doing more now than I was doing, 2 years ago, because the knee pain was kind of holding me back, but I feel great.
So PRP is where we take a patient's platelets and we actually spin them down and inject them into a damaged tendon. So that damaged tendon could either be in the elbow, in the Achilles tendon, or like for plantar fasciitis. Those platelets actually have growth factors in them, and we use an ultrasound machine to actually inject those growth factors into the damaged tendon. What that does is that stimulates the body to come in and form cells so that it can actually heal that damaged tendon and alleviate their pain.
I've always enjoyed an active lifestyle. I've always enjoyed fishing and hiking, doing things with my boys, really enjoy riding my motorcycle. But about 10 years ago, I injured my knee and resulted in a surgery. They put pins in. But even after that surgery, the active things that I did still resulted in pain and swelling. So I didn't enjoy them near as much, and I didn't do them as near as much. After the cartilage replacement surgery, things really changed. I could do those things, and I found I wasn't in pain anymore. I could even do things that I never thought I'd be able to do before. For example, I went snow skiing about 10 weeks after my surgery. So the surgery itself just really changed things for me. I enjoy those things much more than I ever did, and I don't have the pain and swelling anymore. It made a big difference in my life.
So stem cells is where we take a patient's cells, either from their body or from another source, and we actually inject it into an injured joint. So if you have a knee that has osteoarthritis, especially in a young patient, and you want to try to buy them some time, what we can do is we can take these cells from your body, and these are cells that have not quite formed yet, and we actually put them into the knee, and where the knee has cartilage, it'll actually start regenerating cartilage for this patient, which will in turn decrease their pain and allow them back to a more normal lifestyle.
Baseball is very important to me, and without it, it would have been very life-changing. That became a very real possibility to me when I heard about my surgery. After I injured myself, it hurt every single day. It impacted every aspect of my life. My parents talked about it with me every day about what we were gonna do, and it became my life. But with the cartilage transplant, I was able to get back to baseball.
With the technology of restorative orthopedics and regenerative orthopedics, injecting stem cells, injecting PRP, or actually taking cartilage from another person and then placing it into your knee, you can potentially get back to a normal lifestyle without having to live in pain and actually get back to the activities that you want to do.